Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's exactly what I intend to do with this podcast as well. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Victoria Akindeko, Brayden Glapion, Hsuan Lin, Ken Roberts, and Jessica Romanus are joining us to discuss their evidence-based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of these students' evidence-based practice poster to accompany this podcast episode. You can find this resource in the show notes on the podcaster app that you're currently listening to. Now, without further delay, let's turn the show over to Brayden to get us started.
Hello, listeners. My name is Brayden Glapion, and on behalf of my other group members, I'd like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Pelvic Floor Disorder Management, and the members of our work group are Victoria Akindeko, Brayden Glapion, Hsuan Lin, Ken Roberts, and Jessica Romanus. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana.
Thank you for introducing your team to our listeners, Brayden. I'm excited to hear more about your group's topic and to hear from each of your group's members as we continue with today's episode. So let's not delay this any further. Brayden, can you tell our listeners about the topic your group selected for your evidence-based practice project and why your group felt that selected topic was important to the nursing profession?
Pelvic floor disorders are a group of conditions that commonly affect women of reproductive age, often leading to distressing symptoms such as urinary or fecal incontinence, pelvic organ prolapse, and chronic pelvic pain. These disorders occur when the muscles, ligaments, and connective tissues that support the pelvic organs become weakened or damaged, often due to factors like pregnancy, childbirth, aging, obesity, or genetic predisposition. Traditional medical and surgical treatments, while sometimes effective, can come with significant drawbacks. Surgical interventions such as mesh repairs, reconstructive procedures may lead to complications, including deterioration of essential supporting structures, reduced blood supply to the area, and even nerve damage. These risks can result in long-term discomfort, worsened symptoms, or the need for additional procedures in the future. Because of these concerns, many women are now seeking safer, less invasive alternatives for managing pelvic floor disorders. Options such as pelvic floor physical therapy, biofeedback, electrical stimulation, lifestyle modifications, and emerging regenerative medicine approaches are gaining attention for their potential to improve symptoms while preserving the integrity of pelvic structures. With increasing awareness and advancements in non-surgical treatments, more women have the opportunity to find relief from pelvic floor disorder symptoms while minimizing risk and enhancing their overall quality of life. Research on pelvic floor disorders is essential to improve early detection, develop safer and more effective non-surgical treatments, and enhance patient outcomes. Research can help educate both healthcare providers and patients on better management strategies. Advancing knowledge in this area allows for improved nursing interventions, leading to higher quality and patient-centered care. For the nursing profession, understanding pelvic floor disorders is essential as nurses play a critical role in education, early detection, and patient support. Many women suffer in silence due to embarrassment or lack of awareness, and nurses can help break this stigma by initiating conversations and providing guidance on conservative management options. Nurses also assist in post-operative care for those who undergo surgical interventions, ensuring optimal recovery and minimizing complications. Additionally, because pelvic floor disorders can affect mental health and intimacy, nurses provide holistic care that addresses both physical and emotional well-being. By increasing awareness, promoting preventative strategies, and supporting innovative non-surgical treatments, nurses can make a significant impact in improving lives of women affected by pelvic floor disorders.
Thanks for explaining some key background information about what pelvic floor disorders are and some of the negative consequences of experiencing these pelvic floor disorders, Brayden. Now, Ken, can you tell us what your group did next within this overall evidence based practice project?
So, after talking about our topic and why it is important in nursing practice, let's discuss our evidence based practice question. So, we used the PICO format, which includes population, um, intervention, comparison, and outcome of treatment modalities to form our question, which is in women of reproductive age, what is the effectiveness of non surgical interventions as compared to surgical interventions in the management of pain for patients with pelvic floor disorders? So, we went through existing literature from different sources and comparing different treatment modalities, surgical versus any other kind of non-surgical intervention, and follow up of how their pain is managed in comparison to each other. And this highlights the benefits of pelvic floor physical therapy over surgery.
Thank you for sharing your group's PICO question with our listeners, Ken. This question served to focus your group's investigations into the literature. Can you tell us more about how you used the PICO question to help you find published research studies about your selected topic?
So we used our PICO question, which was in women of reproductive age, what is the effectiveness of non surgical interventions as compared to surgical interventions in the management of pain for patients with pelvic floor disorders? And after this, we formed some key search terms, which included surgical versus non surgical, pelvic floor dysfunction, vaginal repair, fecal incontinence, urinary incontinence, and chronic pelvic pain in order to find articles from a few databases, which included Wiley Online Library, EBSCO, Medline, and PubMed. To narrow down our articles even further, we used some search limiters, which included only using peer reviewed articles, studies that were published within the last 5 years, and studies which focused primarily on female population, particularly women who had recently had childbirth. Our literature search went very well as you were able to find a sufficient amount of relevant articles, but we did hit a few roadblocks, some of which were due to the nature of the articles. A lot of them were not peer reviewed, some of them were hidden behind paywalls, and we had no way to access them to actually find out if these articles were relevant in our use. So, a good way we were able to find out if articles were relevant for our study was following the guidelines that were provided by our professor in the beginning of the class. And that was how we were able to narrow down which articles were relevant and which articles would be sufficient enough for us to use as evidence in our research.
I appreciate your sharing some helpful insights into your group's literature search process, Ken. I'm glad your group had an overall positive experience with your literature search project. I tend to spend a lot of time doing various small scale literature searches myself, and there is nothing more frustrating than finding what seems to be the perfect study article only to find yourself unable to access it because of a paywall. Therefore, I can absolutely commiserate with what your group experienced. For our group members presenting today, you have full access to a university academic library as part of your student resources. Even if your university does not currently subscribe to a particular journal or database, university libraries can typically access the resource you need through a process known as intra-library loan. This process is not just associated with university libraries, by the way. Public libraries for our non university affiliated listeners also typically have intra library loan capabilities. Basically, intra library loans involve a preformed network of libraries that can share resources amongst each other. I've used these services many times as a faculty and as a graduate student. Most of the time, I was able to retrieve an electronic copy of a study article that I needed via interlibrary loan services within even a couple of hours at no additional cost. Depending on the interlibrary loan terms and availability where you would be looking for them, there is sometimes a nominal fee associated with borrowing resources outside of your immediate library's access. However, these nominal fees are much less costly than even a single article access behind a paywall. If you ever find a source, even physical copies of books that you need to complete a research project, check with your affiliated university or public library to see if intra-library loan services might assist you in getting the resources that you need. Speaking from past experience, your librarians will be very happy to help you in this endeavor. Now, after your group reviewed the retrieved peer-reviewed studies, what key evidence did you discover pertaining to your group's PICO question that you shared with us earlier?
After conducting our literature search using the methods previously described, we sorted through various study articles to identify high-quality research that specifically addresses our evidence-based practice questions. Each group member was responsible for critically appraising one study, and we synthesized the findings into a comprehensive synthesis table. This allowed us to see the bigger picture of the scientific evidence surrounding the effectiveness of surgical versus non-surgical interventions in managing pain for women of reproductive age with pelvic floor disorders. The studies in general overwhelmingly support non-surgical interventions as an effective measure in reducing pelvic floor pain, often with fewer risks and complications compared to surgical approaches. These interventions include pelvic floor physical therapy, biofeedback, lifestyle modifications, and medications, all of which are relatively non-invasive and can be individualized to the patient's needs. Many of these treatments focus on improving muscle function and addressing underlying causes rather than just treating or repairing the symptoms. While some surgical procedures, such as hysterectomy, are used to address severe cases, they carry potential risk like prolonged recovery time, post-surgical pelvic floor dysfunction, and complications that can impact long-term health. Even minimal invasive surgical techniques, such as laparoscopy procedures, may contribute to long-term pelvic floor impairment, which is an important factor to consider. Also, the studies reviewed followed a quantitative clinical research model with extensive follow-up, ensuring that the data was reliable and provided long-term insights. Each study focused on women of reproductive age actively experiencing pelvic floor pain, making the findings highly relevant to clinical practice. A common theme in the research was the strong correlation between multiple pregnancies, advanced age, and an increased risk of pelvic floor dysfunction. Women who have multiple vaginal deliveries are at greater risk for weakened pelvic floor, which can contribute to urinary incontinence, prolapse, and chronic pelvic pain. This highlights the importance of early intervention and preventative strategies, especially for women at a higher risk. In general, our synthesis of the literature strongly supports non-surgical interventions as the preferred first-line treatment for pelvic floor pain, women of reproductive age, as these approaches offer effective pain relief while minimizing risk, making them a safer and more suitable option for most patients.
Excellent discussion of the studies that your group reviewed, Victoria. I appreciated that you shared some of the synthesized findings across multiple studies, especially related to which women were more at risk for experiencing these pelvic floor disorders and how the less invasive non surgical options may be just as safe and effective, if not more so, perhaps, when compared to the surgical options. Now, Jessica, can you tell our listeners about some additional key implications that nurses who work with this specific patient population should consider based on the literature your group reviewed?
So, based on the information our group reviewed, we identified several important takeaways for nursing practice, particularly in specialties such as women's health, obstetrics and gynecology, urology and primary care, nurses working in hospitals, outpatient clinics, and community health settings can apply these insights to improve patient outcomes. One of the key aspects of care is patient education. Nurses should guide women in understanding non-surgical treatment options such as pelvic floor exercises and lifestyle adjustments. Providing clear instruction and ongoing support can help patients effectively manage their symptoms and enhance their overall well-being. Additionally, consistent assessment and follow-ups are essential. Monitoring changes in symptoms and evaluating the effectiveness of interventions allow nurses to tailor care plans to each patient's needs. Adjustments based on patient responses ensure that treatment remains beneficial over time. Preventive strategies also play a significant role in managing pelvic health. Early detection and proactive care can help reduce the risk of complications. Nurses can educate patients on recognizing early signs of dysfunction and encourage routine screenings to address concerns before they worsen. Finally, supporting patient involvement in decision-making strengthens adherence to treatment and promotes better self-help care. By fostering open communication, nurses can empower women to take an active role in managing their health, which can lead to more positive and sustainable outcomes. By applying these principles in various clinical settings, nursing can enhance the quality of care for women experiencing pelvic health concerns and contribute to long-term improvements in their well-being.
Thanks, Jessica. You provided our listeners with some helpful takeaways that nurses working with women with pelvic floor disorders may need to consider. I especially appreciated the focus on preventative measures that may be helpful to teach our patients, especially after vaginal deliveries, which are associated with increased incidence of future pelvic floor disorders, as you mentioned previously. So, Jessica, did your group find that there are any gaps in the present literature that may require further research investigations in the future?
So there are still gaps in the existing literature on this topic, highlighting the need for further research. Our group has identified key areas where additional studies could provide valuable insights. One priority is examining the long-term effectiveness of non-surgical treatments. While options like pelvic floor therapy, dietary modifications, and hormonal management have shown potential, there is still limited data on their sustained benefits compared to surgical interventions. More research is needed to determine how well these approaches manage symptoms over time, particularly for women of reproductive age. Another critical area that is a need during future research is the need for personalized and culturally inclusive care. Many studies lack diversity in their participant groups, making it difficult to assess how different populations respond to treatment. So, future researchers should explore how individualized, culturally sensitive approaches impact outcomes, ensuring that treatment recommendations are effective for patients from various ethnic, socioeconomic, and lifestyle backgrounds. By addressing these gaps, future studies can provide stronger evidence for treatment decisions and help improve care for a broader range of patients.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies that your group reviewed for this project, including any considerations for study weaknesses and the continued gaps in the present literature you just mentioned, what was your group's overall literature-based answer to your original PICO question?
After all of the research studies that our group reviewed, we were able to determine an evidence-based answer to our EBP questions. So based on the 5 articles we reviewed, they partially answer our PICO question. They contain relevant information regarding non-surgical and surgical interventions for pain management in women with pelvic floor disorders. However, they do not directly compare their effectiveness for pain management. Throughout this semester, we learned how important evidence-based practice is in healthcare setting. It enhances patient outcomes, ensures safety, and optimizes resource utilization. Evidence-based practice integrates research, clinical expertise, and the patient preference, promote the high-quality, effective, and personalized care, which ultimately improves the overall healthcare system. Research is a component of evidence-based practice. It is essential to ensure that clinical practices and policies are based on the latest scientific evidence. By reviewing research, healthcare professionals can enhance patient care, improve treatment outcome, and advance medical knowledge. So both evidence-based practice and the research are crucial to the profession of nursing. Due to this project, we learned how to integrate research into practice, apply practice based on the research, and collaborate as a team. And in an effort to become a better nurse in our future or own career, we have to promote continuous learning and evidence-based decision making.
Thanks for wrapping up your group's discussion, Lily. I'm proud of each of you for integrating the content that we've discussed in our undergraduate nursing research and evidence-based practice course into this real-world literature search process. I think the thing that I want to call attention to the most as we close this episode is that evidence-based practice is more than just what does the research say. As you mentioned, Lily, EBP encompasses the best available research evidence alongside the patient's preferences and our own clinical expertise as nurses. Those components, in addition to considerations of limitations related to staffing or other resource constraints, work together to encompass what we mean when we use the phrase evidence-based practice. I'm thankful that you mentioned this in your concluding remarks. At this point, I would also like to thank our listeners for going on this journey with us. Discussions about women's pelvic floor disorders are not always readily available. Many women suffer with these negative symptoms like pain and incontinence in silence as the presumed cost for going through the labor and delivery process. However, as healthcare providers review the research evidence surrounding this topic further, there may be increased emphasis placed on trying less invasive, non-surgical options to ameliorate the symptoms and improve these women's quality of life. Again, thanks for joining us today.